have 8 areas of concern. Okay. 8 areas of concern lay. The area of concern Z. Say one of the most neglected area of concern. Once if we know it properly, the score not only that, tools and methods if we use it, if we apply it in our day-to-day practice, the first thing process mapping process quality of care. If we talk about quality of care, mainly it's derived from Donabedian model. Model we have structure later. Structure is input, then process, then outcomes. Structure is whatever manpower or whatever equipments, materials, inputs. Then after that, then we do some sort of activities, process, small activities. Process. Clinical care, then the hospital activities. Then ultimately, outcomes outcomes in a sort of measurement. Input process activities. Outcome what was the outcome? Outcomes whether it is as expected, expect outcome process model based again area of concern. If we look at the 8 areas of concern, an individual area of concern, some are structure related or inputs related, some are process outcome. Predominantly Enquasky 8 areas of concern predominantly process driven standard process say for example patients right process support service area of concern process area of concern clinical service process infection control activities process even quality management documentation record out of these 8 areas of concern, 5 are process related. So in terms of percentage, more than 70% of the activity score and Quaspi standard score set process related activities. Then less than 30% are the remaining inputs or structure outcome. The outcome and service provision, these are the outcome structure input side. Absolutely inputs. Mainly in Quaspi standard C, they are predominantly process driven by activities. And now let's see what is process. The process is a set of interrelated or interacting activities which transforms input into output. As I have process is activities input output process a series of steps which converts one or more inputs into one or more outputs. The process mapping. What is process map? Process mapping is a graphical representation of the series of steps of a process. It's a representation of the series of steps graphically when you represent a pictorial representation of the sequence of actions that comprise a process. the mana it traces the flow of physical product and information through step. There's no physical product, the map is used to document the step-by-step activity. Mathang kano diniko. Sagi kogi activities se silver baga mathang kai lakba haiba adugi processing se for example kogi activities sama haira se OPD registration or OPD examination or ANC registration, ANC check process as soon as patient enters the primary health center, complex health center, kari tawgadabno haibda mathang haitare process mayam se akoina hujik tawriba singduni ko why process mapping tawrise kai process maps are a great problem solving tool amoi. It help us determine what is the problem at the problem areas akoina hujik tawriba activities singsi graphically on a represent tawuni duga tawriba activities se like when we see it graphically visually when we see it we can identify those problem areas atagi in any step for Canada ba steps in identify the work namakani then adudagi di akoina madu remove toroga karamba step kano to sige habito adugi potuni ko then graphically then we can develop understanding about the process improvement improve tawni hadi so hangani ko magi process mapping is some of the advantage it increase efficiency eliminate non value added activities reduce cycle time if we do process mapping madu cut down madu improvement rectification correct expand service capability, simplify workflow, minimize dependencies. Step currently for the process map we use symbol the symbols symbols circle overlay, then rectangular overlay, then diamond separate the flow of the activities arrow na represent some of the symbol used to process map. For process mapping, we use certain symbol. Say, for example, start and end. We use an oval symbol. I say, so it is used to show the material, information, or action to start the process or to show the result at the end. Oval shape symbols start and end. Any activity, next activity, we use a box or a rectangle, which is used to show parts of activity performed in the process. And multiple arrow may come into each box. Arrow is the input company kangde sagi mayam se or multiple arrows in the process. Sagi processes the usually only one arrow. Then usually box or a rectangle only one arrow leave is box. Then another shape symbol diamond shape decision where step where a decision making is required where a yes or no question is being asked or a decision is required. Then circle is a break. If there is no space, I don't suppose. Next space, the continue to then we use circle, then space. Yes. Yes, any question? Okay. So some of the important points the process map, what is, not what you would like the process to be. Akoina map tawrise pamba the process mapping is a dynamic process. Dynamically, it may change from time to time. Say if any new methods or new ways, then we can put it back on to the way not post-it notes then marker temporary marker if we have a whiteboard because temporary marker in fact, actually, it's a dynamic process, and all process map must have a start and stop point. The bottleneck occur when a step is the limiting rate. Particular step say limiting rate already. Say suppose the step takes a significant time and it slows down the whole process. Certain bottlenecks graphically identify the for example, see just example it's a process map showing patient flow in adult emergency. Say client approach hospital grade. Say screening at the pre-triage area. Pre-triage area, it's in COVID ki matamda haragadi like COVID ki screening to COVID suspect pre-triage say then if it is COVID suspected patients or COVID positive patient already, yes, I get the isolation 1,000 give up. Then COVID negative COVID patient already with trials full admission the emergency department. Sangani then emergency department whether the patient fulfill the admission in emergency department. Yes, no answer. No, that the general but then if it is emergency stay then we send according to the patient profile limit in what is the issue then if it is not severe disaster or disaster and if it requires further management at the higher center referral and certain investigation it's a graphical representation the flow of the patient at the adult emergency likewise patients ANC checkup ki hiro any patient flow check have say normally routinely then if we need improvement we can rectify certain steps this is process mapping. Next, another important tools regarding quality tool is audit. Audit same everyone we know we heard it very often. Audit yes finance ki auditing the audit ki literal meaning say to look into audit is not a fault finding exercise. There is a fault to team but heck when a team it's not for audits are not policing at the police na intention be that the punishment the mong mibu but for policing idea and as well with improvement activity. Audit is not an external quality assurance method, external internal mechanism within the facility. Internal mechanism of quality improvement had effect control method risk plan manage. What is audit? A systematic review and analysis of any service delivered and its evaluation in terms of quality within given resources. It's in a definition later. a tool to find out what you do now in comparison to the past, what you should do in the future. I hꯧꯖꯤꯛ ꯇꯧꯔꯤꯕꯁꯤꯒ ꯃꯃꯥꯡꯗ ꯇꯧꯔꯤꯕꯁꯤꯒ ꯀꯝꯄꯦꯌꯔ ꯇꯧꯕ ꯑꯗꯒꯤꯗꯤ ꯗꯦꯟ ꯃꯇꯨꯡꯗ ꯀꯃꯥꯏꯅ tool ꯑꯃꯅꯦ to analyze the best things in the best way. Best things best way they analyze the prerequisite of an audit good record keeping. Audit process ama tawge higher then there are certain prerequisites. Number one, we should have a good record keeping system. Record keeping system yang fazana lai tabani because audit yang agadi akogi mun yengkalaktuni ko whatever we have done in the past to whether it was done in the correct way or properly. Record system fazana laiba tai then it should be carried out by fair and impartial professional. Adi kogi masida yamna fair oiba mongda impartial oiba changmikhai naidaba mongda conduct tawtabani amadana changmikhai naiba then particular department amadana changmikhai naidaba hairiba jaga kai hai masigumba laiba mi yade auditing tawriba kano singse professional singse. And clinician, nursing, and other staff, as well as patients, anonymity is to be maintained. So that all the audit over the Mama Tolokani, Nurse Kanana, Nato Kopa, Yamto, Doina Kangdoribini, I don't know the Yankshalatorim. Then there Mogi Masak Nato, Masak Kanano, Havasi, Masikan Bayatiko. Confidentiality should be maintained. The patients or even the patients get patient anonymity should be maintained. Purpose should be simple and clearly stated. My purpose is clearly stated. Initiative should come from within and ensure intention should be to effect change for the better. System PAC within the PAC system, we have the basic starts in the not an external quality, it's an internal tool to further improvement. Defining the purpose, guiding principle for defining principle audit what are the purpose to improve the quality, to enhance performance, to increase efficiency, to change procedure. For example, to ensure autograph is maintained for all normal deliveries. Audit question whether autograph is maintained for all normal deliveries. Yes, no, and no, and checklist then to increase the average length of stay of the delivery at least 48 hours for example other complications to observe purposing to improve the blood transfusion reaction monitoring blood transfusion reaction monitor the importance of well-organized medical records. Clinical record keeping is an integral component in good professional practice and the delivery of quality healthcare. Regardless of the form of the records, electronic or paper, clinical records should be updated where appropriate by all members of the multidisciplinary team that are involved in the patient care. The clinical records, document especially for medical audit and can be used for investigating serious incident, patient complaint, and compensation cases. Example of a clinical record say, patient complaint or a serious of incident, medical legal case will hire the compensation can go back to the records, the report yeah, the record keeping is very important. The audit cycle, cycle before doing the actual auditing, preparation, planning then after that measuring the level of performance measure then once we identify performance below par or then room for further improvement, making improvement we will then start hello, yes, sustaining improvement. Then this cycle just mentions then some audit if we go on doing auditing then some improvements is in idea. There's one constituting an audit committee. Say for example, debt audit. For debt audit, it can be conducted by maternal debt review committee. Maternal debt review committee especially at the level of CIC, the district hospital level, we have maternal debt review committee, debt committee, same way. Maternal debt review committee it's compulsory committee same right later already then prescription audit at the district hospital level we also have a drug and therapeutic committee same prescription audit the way the committee will be responsible for conduction of requisite training the training then conduction of training for audit, selecting areas of interest, providing necessary resources. There will be existing guidelines, standard treatment guidelines being defining the standard for the area chosen, then providing the necessary resources later, select the criteria. There should be in the form of this should be in the form of statement, certain statement criteria, standards, and for a photograph is generated in at least 90% deliveries in level. See, criteria standards is same in audit whether photograph is generated in at least 90% deliveries in level or yes, no, just audit yes or and no or then areas low performance we need certain improvement to come with it. Then audit standard will come from standard statement guidelines of best practice. So, standard is an audit standard is a minimum level of acceptable performance for that criterion. Particular criterion to be standard activities in the same at the car lay. For example, say at least 80% of eligible women as at 25 to 65 years should have had a cervical smear in the last 5 years. Second criteria, this is the standard. During the last 5 years, women as at 25 to 65 years should have a cervical smear. At least 80%. Whether we have. Whether then 80% of the time, blood transfusion begins within 1 hour of the decision to transfuse. Blood transfusion. See, within 1 hour, the 80% of the time, then 80% of the patients suspected or diagnosed uterine rupture or emergency surgery should be performed within 2 hours. Uterine rupture emergency surgery within 2 hours the perform 100% of drug and crash card should be updated. There should be no drugs in the crash card expired. Standard set how to set standard? By looking at the national guidelines, treatment guidelines, like any literature textbook, local guideline, then it can be set along with discussion with the consultant, discussion with trainer, partners, Tanaraga, standards is set out in the level of performance, stage to Siduna, Sagi audit key stage to the level planning data collection, the method of data collection, handling data, analyze data collection. Sagi audit actual audit to Tauronico, Taurocanta, data collect maybe by start the hand and about interview to different methods later. Clinical records. Making stage 3 is making improvement. Once the data collector analyzed, then we found out the result of the audit record. Then we present the third stage. We present the results and discuss them with the relevant stakeholders in the facility. The results should be used to develop an action plan. Then specifying what needs to be done, how it will be done, who is going to do it. Action plan. Next step is to implement the action plan to achieve the desired outcome. Then last is sustaining improvement. The audit suggested under NQuas. Okay, NQuas ki makhada there are audit currently just to highlight the clinical audit, debt audit, prescription audit, referral audit. No. Any question? Maternal death audit, newborn death audit, child death audit. These are the different types of audits suggested under NQuas. Any question? Hi, ma'am. Hello.
Tay.
Oh, okay. Any audit se makan sida mayam amal lejare ko. Simiam se tawi maternal death audit, koi child death audit kai sidi koi district hospital atau hospital gumba tawi ko. Lagi koi sida tawi clinical audit, AoC level the clinical audit tawi lagi in case of any death, death occurring in the PAC, death audit tawi prescription audit si masih tahu mathau tai quasi PAC level the so them bagi doctor sing leibanina moina prescribe to ba kaino si prescription gi mong si kamai to ko le si yeng ba si to ya and referral audit so bagi referral form lebra khotra then advanced communication on a actually referral audit si loina madu tawra matungda moi khanga kani kadai da to bi that awat palege whether there is room for improvement. Sina some of the suggested audit the it was different audits later medical audit. I just it covers all aspects of clinical care, including that provided by medical, nursing, and paramedical staff. Not only medical doctor nataba nursing paramedical staff provide them covered. Then that audit is important because it gives an understanding to what happens in why. Very circumstances in what circumstances that occurs, whether there was any lapse in the care people any what this has to go beyond rates and ratios to determine the inciting factor and to take measures how that could have been avoided. Also, the prescription audit. Prescription audit is a tool for identifying the error in prescription practices. To reduce the occurrence of medication error, the prescription auditing is very useful tool that can be used to generate data on several aspects of medication. Particularly medication, the prescription, medication error, main objective to reduce the occurrence of medication error. misuse กุมตัวบุคคลป่ากุมแม่ clinical audit is the systemic critical analysis of the quality of clinical care including the procedure used for diagnosis. The clinical audit is a way of improving the care of patient by using a multidisciplinary approach when appropriate to take what you are doing and see it. Much tool in seasonal, it's not a goal. Clinical audits are done at defined interval by designated team for randomly selected cases, preferably retrospectively. In all the cases, with the quality, certain cases, serious cases, in case of patient complaint, from the defined interval, and these are done randomly cases selected retrospectively, I believe, through records. The clinical audit, guys, mainly a retrospective audit care is evaluated after it has been completed through records. Records how the events in the mind of retrospective. Then we can also do concurrent audit. Care is evaluated at the time it is taking place. To independent actual care period to meet not about without their knowledge. Concurrent audit high. Medical audit. These are carried out on the case sheet of patient. Patient case sheet in a facility over a defined period with the objective of determining the following: whether the admission treatment was justified, admission treatment P was justified, whether the diagnosis documented was as per the ICD, the International Classification of Disease, International Classification of Disease, disease low in a classified whether the medicines prescribed were as per the standard treatment guidelines, then whether the investigation order were appropriate. Investigation appropriate, whether the follow-up of the patient was timely and appropriate, refer timely to the appropriate consultant. Follow-up refer to whether the patient was advised and timely transferred, whether the timely detection and treatment of complication was done. Medical audit. Medical audit death audit. All death occurring after 48 hours of admission should be subjected to death audit. Admission 48 hours all the deaths should be audited every month. The death cases are examined in terms of qualitative and quantitative adequacy of various parameters used. Investigation treatment given in comparison to normal standard, delay, whether there was any delay in examination, investigation, or initial treatment, then types of consultation obtained and recorded, daily monitoring of progress. Now we come to prescription audit. Prescription audit is a written, verbal, or it can be verbal. Say, for example, telemedicine, doctor consultant, doctor verbal or electronic order from a practitioner or designated agent to a pharmacist for a particular medication. The prescription audit is a part of clinical audit. Clinical audit it's a tool to improve the prescription quality and ensure patients get high quality of care outcome. Supposed to measure performance in terms of prescribing practices and patient care. The characteristics of a good prescription. Good prescription my characteristics. Number one, complete. Should be complete. Prescription is complete in all respect. Date dates name, age, sahi, sex, canopy, address, weight if needed, special instructions and details of follow. Number two, legible. Prescriptions are clear and legibly written. Clear and any prescription, preferably capital letter the EU. The small letters, lot of confusion. May cause a lot of confusion. If we write it in capital letters, then we see confusion. Can say later. Clear preferably capital letter. Number three, use of zero. Leading zero should be preferred. Leading zeros any decimal point mamang the haitara. Decimal point of the mamang the zero madudi preferred to pay. But trailing zero should not be used. Trailing zero have the decimal point matung the e. Some have the milligrams example. 0.25 milligrams. 0.25 milligrams. If we write it in the acid, OPD ticket, kind of even matter. Point udraga madu confuse chatwene. Madu point lady have in order to indicate that leading zero the zero are 0.25 milligrams. The trailing zero, 5 milligrams, 5.0 milligram by the EVC, prefer to go. Yes, decimal point would be pretty and confuse the trailing zeros, the one the spacing for the spacing, give space between drugs. The spacing drug is space and strength. The drugs the magi strength is some of the Inderal example. Inderal 40 milligram, I will say. Inderal the my strength 40 milligram and if Maraxida space like the Inderal 40 say L 1 mislead over 140 milligram. Mine low spacing, proper spacing. Then number 5, the symbol and abbreviations. Avoid error-prone symbol. Abbreviations to the extent symbol. Many drugs identified with abbreviation. Some with the EX kind of HCTZ for hydrochlorothiazide. MSO4 for morphine sulfate. Maximum say either but the similar precision audit standard procedure combined OPD IPD ticket should be standardized. When OPD ticket IPD ticket standardized lower whatever information we need to collect from the patient, the patient details, demographic profile, details, that investigation clinical finding standardized random collection of prescription cases, prescription audit of randomly collect randomly collection. Representative only OPD emergency prescription. Only OPD emergency prescription prescription. Xerox copy, documents, Xerox copy document, report. Adequate sample size, minimum in a month, 30 prescription audit over the 30 sample OPD ticket. OPD, not only OPD, emergency days later low IPD case issue. Minimum harm just like patient satisfaction survey over the 30 prescription. For prescription audit also we collect minimum 30 each sample per month. Now, what are the steps for prescription audit? Number one, the availability of prescription audit format. Prescription audit format like tabani. Prescription audit format like I will just share it later on. We depute a person for collecting the prescription from OPD, pharmacy, MRT, or IPT. Particular person about the depute of prescription collect collect one collection collect at least one prescription per day and numbered. At least normally one prescription collect randomly collect then analyze the prescription as per analyze the prescription as per audit tool. Put the number one. If compliance meet the one only, if compliance not met, then 0 begin. If any point of audit tool is not applicable or the NA mentioned Tony, then we calculate the compliance and generate the score of prescription audit. Compliance to calculate only to get score to generate. Indicate low performing attributes as per audit tool and discuss this attribute with your committee and doctor for corrective and preventive action. Low performing attributes se karamano khadooga low performing attributes amani haitare these two khadooga kona committee sida discuss corrective and preventive action. After that, do the re-audit again, check the compliance. Because re-audit you will check the compliance. It's an ongoing process. This is the prescription audit format. It has 27 attributes. I just read. Number one, I say OPD registration number mentioned. Response yes, no, NA. NA is not applicable. OPD registration number IBIBRA. Yes. Complete name of the patient is written. Patient name complete IBIBRA. Yes, no. Age in years. Yes. Greater than or equal to 5 in years. In case of less than 5 years, in month. Sahi manga natra manga the hell years the EBU high. In case less than 5 years over the month weight in kg. Kg that. Only patient operated angang ini ayamba. Aduga angidi ayamba yam kana the quality the 5 the might weight. Date of consultation, day, month, year, then the gender of the patient. The handwriting is legible in capital letter. Handwriting is capital letter, the IBRA. Whether brief history is written, allergy status is mentioned. I think then salient features of the clinical examination is recorded. And then presumptive or definitive diagnosis is written. Actually, doctor, medical officer, provisional diagnosis. Whether the medicines are prescribed in generic names. The medicines prescribed are in line with standard treatment guidelines. The medicine schedule, doses, schedule, dose is whether it is clearly written. I think then duration of treatment is written. Duration can be the date of next visit, review, return. Next visit lakani. It also should be written. In case of referral, the relevant clinical details and reason for referral given. In case of referral, the details in clinical details in whether the reason for referral say reason say in a day masima karigino have to do referral slip labor copra and pasla the referral slip any referral slip maintain to hold them. So referral slip say the reason for referral say follow up advice and precaution do's and don'ts are recorded. Then prescription duly say CD may not be applicable in all the cases. The prescription is duly signed, legibly signed tauba fazana sign tauba daka lai iba miduna ko legibly medicine are as per essential medicine list medicine advice are available mana advice dispensary available the vitamin tonic for enzymes prescribed antibiotics prescribed antibiotics are prescribed as per the facilities antibiotic policy prescribed with investigation investigation advice the way injection prescribed number of medicine prescribed medicine machine simyam je akoina prescription audit ta koi loina record tawani ko adagiri then we calculate the score if it is 100% to 75 above or 75 to 100 then yes rational if it is 50 to 75 semi rational less than 50% not acceptable yeah they got the prescription audit common prescription error prescribing investigations that are not required another prescribed over then over prescription straight away for generation antibiotics prescribed over the complex prescription more than one drug when only one drug is required the prescription of tonics without indication the diabetic patient the sugar based tonics hidak mayam sugar yauba haitare rest of then advising investigation outside when available in health facility for health facility layland outside the advice investigation advice of adherence to the essential drug list and standard treatment guidelines then preference for branded drugs unnecessary prescription of injections non-documentation of drugs prescribed other than essential drugs common prescription error gap identification any gap conducting audits in a pelati and audit any gap identified we have to categorize it through structure process and outcome structure kari no facilities being provided patients complain too long to get an appointment the appointment level waiting time the availability of staff is later record keeping equipment award structure the process what was done to the patient referral gi matangda yamna delay tawraga refer tawba prescribing error mayam leiraba investigation unnecessary investigation for example identification of high risk pregnancy fazana tawbidaba process related error gap mata oiduni ko outcome the result for the patient patient satisfaction the nemakpa hypertension patient aged within 20 to 30 so diastolic below diastolic BP below 90 like result of service outcome high risk practice in terms of structure process and outcome so this ends regarding audit there are different audit OPD level PhD level prescription audit very important we have to do prescription audit monthly at least 30 samples see and cost la prescription audit my record now we come to quality policy vision mission objective policy one of the standard standard G quality management whether the facility has quality vision, mission, quality policy labor, just terms we just mama appointing ba objective, the policy na kaino, vision na kaino, I was just clear. I just want to highlight a few points. Quality vision vision and mission. Vision lays out the future. Vision the future broad. That is what the organization wants to be in the future. It is a source of inspiration and motivation. Vision future the organization, any organization, maybe a district hospital or district health facility. Health facility organization want future what we want in the future. Layout it will be a source of inspiration and motivation. Vision do clear cut achieve source of inspiration, source of motivation. That is vision. Mission mission describes present. Mission is present. What organization wants to do now to achieve desired level. Organization in order to achieve a particular desired level. It defines the customer's critical processes and it informs the desired level of performance. In a nutshell, the broad statement not only about organizations, goals, and objectives, but serve different purposes for it, often confused with each other. When the future vision the mission and vision statement of the healthcare facility have direct the organizational strategy. Vision and vision statement healthcare facility direction direct mission and vision statements help to outline performance standard and metric based on the goal they want to achieve. They also provide employees with specific goal to attain promoting efficiency and productivity. Without mission and vision, the plan exists in effect. Mission vision later the plan and as the mission is a starting point for planning, the vision is the destination. Mission is the starting point. Present vision is the destination. The strategic plan is the roadmap that helps you navigate from one to another. The quality policy is should be the goal goal of the organization. Quality policy goal is broad statement. Policy is a reflection of the goal of the organization. It can be used as a filter for decision. Quality policy statements should include a brief description about your organization business, a quality statement relevant to your organization, a commitment to continuous improvement in customer satisfaction, a reference to the process and system in your organization. Quality policies health wellness center uniform policy uniform objectives health care facility to be reference to objective and how they are reviewed. Quality policies organization goal broad statement these policies are essential in ensuring effective planning of processes because they lay down rules to be followed to ensure that actions and decisions taken serve organization objective and expectations. Policies, any document such as safety policy, we have different policies, safety policy, organization intention with respect to hazard in workplace, personal policies, how organization treat its employees, social policies, organization interface with society policy same way. For example of the quality policy quality policy example. We shall strive to provide preventive, promotive, and secondary level of curative healthcare services.
class udro. Itu udro. Nana tak dokter sih ando.
Hello. So this is an example of a quality policy. These are broad what our organization wants to achieve. I'll just read out. We shall strive to provide preventive, promotive, and secondary level of curative healthcare services to the people in the region with sustained efforts to ensure that it is equitable, affordable, accountable, and responsive to the people's need within limitation of its resources. We are committed to delight the end users of our services by efficient service delivery. So these are example of especially secondary level healthcare maybe district hospital in case of PAC it will be different. Basically different when in case of subcenter different. Quality objectives are quality oriented goal. The quality objective is something the organization aims or try to achieve. The main objectives ni ko matam bi akogi gap se akogi loss the quality objective should be smart. Checklist whether the quality objective are smart SMART. Smart say S should be specific. Objective should be specific. M means measurable. It should be measurable. When I say objective, so measure then A means attainable, which we can achieve. Okay. R means relevant in the present context. That means important. It's really important. It's very important in the current circumstances. T means time bound. For example, when we frame a quality objective, say for example, department increasing the LSCS rate to G% in 8 months, guys. LSCS rate yam low 5%. Yam wang su pate ko se low yes kita kelan bayai 5% layer 10% bauti hengat ke higher then those objectives are to increase the LSCS rate from the baseline current level of 5% to 10% in 3 months kind of or 3 months. Then it is very specific. It's a smart objective. Specific what we want is to increase the LSCS rate. The measurable, yes, LSCS rate can be measured to be then attainable, yes, increasing 5% rate. The next 3 months, yes, we can attain for the relevant Haobam. Even PSS patient satisfaction survey. Suppose we have a very low patient satisfaction survey of only 3 years, 3 later. 3 say now objective set we are now 3 the objective we want to improve at least 4 about the but direct for the secure 3.5 target also. Suppose patient satisfaction, we would like to increase the current patient satisfaction rate 3.5. If you want to increase it, then we can set it as an objective. Objective when set up here. Our objective is to increase the patient satisfaction survey PSS score from the current level of 3 or 3 to 3.5 in the next 3 months. In the next 3 months. Similarly, objective in a set of vehicle. Objective say we can have 2 or 3, more than one objective set of vehicle, and then it is dynamic. Dynamic means from time to time it will be different. Once we achieve, then we can set objective for some other parameters. And the objective is set over it should be smart. I say smart. I say the labor room increasing nighttime deliveries by C% in C months, D% in C months. Nighttime delivery rate say percentage name suppose it's only 10% nighttime delivery. It's very low nighttime. The emergency delivery high if it is very low. The 10% see now nighttime delivery say 10 50% increase the yadoine manana the neighbor haidar. 10 yes 10 to 20 10 to 20 the increase the hunting the minor set in the next 3 months from 10 to 20%. Reducing postpartum infection. I don't know, we can set a lot of objective, and the objective can be changed from time to time. Now we come to quality improvement tools. Certain some of the standards under G quality improvement questions are asked whether we use any one of the quality improvement tools. Quality improvement tools and methods. Tools there are 7 basic quality tools like 7 basic. Histogram like the fishbone diagram, check sheet control chart, Pareto chart, the scatter plot, run chart. 7 basic quality tools other quality improvement tools like PDCA, plan, do, check, act. 5S quality methods. Tool methods and tools 5S. The Gantt chart, brainstorming, flow chart, why analysis, mistake proofing, 6 sigma. The one by one apa yang as PDCA cycle, also called PDSA cycle. Plan, do, PDCA is in a plan, do, check, act cycle. PDSA is what? Plan, do, study, act. The Deming wheel or Deming cycle. See, it was developed by Dr. William Edward Deming in 1950. Plan this phase is for the identification and understanding of the problem. When a problem say identify the understand the phase no problem say here we will define the problem and create and screen the implementation plan and solution to achieve the target or goal. When a gap later, when a gap identification the gap say identify the then a PDCA cycle say gap closure the PDCA cycle apply to the plan to the problem say understand the implementation plan and same action plan phase to plan. Then do here we test the solution on a smaller scale or a smaller geographic area with a small group as a short pilot. It is a testing and trying a process. Actual plan the action plan it may or may not be effective or very as a testing test pilot short pilot we that is the do phase. Then check. It is a process of assessing and analyzing the pilot's test result. Result say check result comment plan action plan later. Then we started implementing it on a smaller scale. Then the third stage, we check whether it is working or not. If it didn't work, we have to return to phase one. Work tꯧꯗ꯭ꯔꯒꯗꯤ ꯑꯃꯨꯛ plan action plan ꯁꯦ ꯈꯤꯇꯪ change ꯇꯧꯔꯒ ꯁꯦꯝꯕ ꯑꯗꯨꯅꯦ ꯍꯥꯏꯁꯦ if it works well we'll move to the final phase action ꯇꯧꯔꯅꯤ the final phase it is an implementation phase here we will implement the idea of solution field. PDCA is always a continuous process and it should run as a loop as a continuous process because there is always room for improvement always kind of like just example for example so this is just a short example in a public hospital there is a plan to improve hand washing practice in hospital due to low hand hygiene awareness, less training and poor hospital infection control management system. Public hospital hand washing awareness training infection hospital infection control management system poor plan training plan awareness then committee ceremony we do the implementation the training was given to all the staff and infection was found to monitor hand washing practice because they monitor check the sixth step hand washing again disinfection my season about disinfection second and indicators were monitored by the MAs and method. See, just an example, my friend small things again. Another is for 5S. 5S. 5S it's a way of organizing and managing the workplace workflow with the intent to improve efficiency. Yeah, it is a quality tool for improvement of working environment. For workplace management sort of yarn 5S. Sort, set, sign, standardize, sustain. Any workplace Japanese low is as say don't say so sekatsu shichuke Japanese word Japanese horrible. So in any workplace what we need to do first thing is sort any unnecessary item necessary and unnecessary item to sort out total we remove all the unnecessary item remove so keep only the necessary item sort that is sort set in order next is set in order the put item materials maybe register maybe items maybe equipment you level it set in order put in order register order then numbering easy identification level order set in order then the third one is sign signs signs whatever we give luna the short set sign 6 steps not only workplace not only here it should be standardized in every workplace in every area standardized standardized standard maintain uniform last sustain not only should be continue future continue sustain as a habit that is 5S. Gantt chart. Gantt chart is a planning tool used to track the tasks. Planning tool chart column then different goals the column the timeline the timeline will be shown in the column for example this is a Gantt chart showing for conducting outreach scheme the timeline activities later serial number 1 2 3 4 5 then activities na it will be written in the row activities in the row the irony then the timeline in the column for first week second week third week fourth week it depicts the timeline of the particular project or work the activities the say particular outreach scheme yes it's a outreach big outreach scheme color the medical outreach scheme including awareness session then laboratory screening then the first thing is obtaining permission from the panchayat or permission from the then we need the arrangement for the vehicle then advertising the public advertising in the public see these activities can be shown according to the timeline and put first week the permission the vehicle arrangement the second week arrangement to public advertisement advertisement second and third week whole second and third week advertisement the IC preparation and print so the last fourth week nothing game timeline likewise activities and course certification is subset of the preparations internal assessment baseline assessment then reporting it to the district quality assurance unit and then district level assessment likewise gate close related activities in a Gantt chart brainstorming the as the name suggests this brainstorm it's an effective problem solving technique used to get a greater number of creative ideas to solve problems. Effective problem solving technique greater number of creative ideas to solve problems. It generates new ideas and provides more options to solve problems. It has the stages of selecting. The brainstorm say a particular the particular problem reason, causes and effect, solution. Not only individual idea is not sufficient. You have to get a lot of ideas from different experts from different aspects. Expert relevant individual brainstorming. Brainstorm say group individual group brainstorming groups in a expert from different areas department different areas of expertise not less than 4 5 idea idea not particular document discussion select every members will be encouraged to speak up brainstorming criticize idea criticize every ideas will be welcome even crazy wild crazy idea turns out to be the best solution so high brainstorming then once discussed already idea further improvement hierarchy the single it will generate a lot of new ideas the option malay brainstorming that's issue important problem solving technique theory that's the flowchart flowchart and the process improvement tool used to analyze series of events in a workflow diagram. Here we can identify the non-value added activities and also will set the flow of work and remove unwanted activities. Flowchart kuma sizinaba this is an example. The flow of patient in an NCD game how the patient's flow will be. It will be shown by using this flowchart. Then patient and entry once patient entry, then there will be a registration counter lerani. Then screening, there will be screening for diabetes mellitus, hypertension lerani. Then will be the physician consultation. Lab test the calibra whether required or not. Accordingly, required or get lab the tharani, and it then no or get directly hit the collection of medication pharmacy target. This is the NCD cake. It's just a simple high type. Those are CD portrait. That's the Sidagi we can identify non-value added activities. Canada portrait portrait icon. Identify histogram can be used to display large amount of data values in a relatively simple chart. It tells relative frequency of occurrence, the distribution of the data to see if there is any variation in the data. Uses histogram is just an example histogram of OPD cases during the year 2022. OPD cases in the year 2022. Subcenter OPD cases in January the 10. On the x-axis we have month called y-axis number of OPD cases. Thus, we can compare the different monthly OPD cases number to visually or graphically line January to March OPD cases low oil. I think the plan is starting from April, it gradually rises. Histogram amaga continuous there is bar between the bar there is no gap. Bar chart bar chart marakta gap histogram quantitative data, continuous data number of OPD cases can distribution of the data can be studied. Whereas we bar charts bar gap it is used for qualitative data is qualitative categorical data for check sheet for service delivery assurance. Check sheet checklist check sheet to high cover. We have been using it now and then for service delivery assurance as well. RCA skill child health checklist, Indian public health standard checklist, mistake proofing, mistake talk to surgical safety, safe birth checklist, for quality assurance, housekeeping checklist, even enforced checklist, it's a type of check sheet. Observation of quantitative must for quality assurance exercise. Quality assurance exercise is check. This is it's a must. scatter plot. Scatter plot is scatter plot. See, it's a graphical display of two continuous variables. This is plotted in a separate x. I'm an x-axis. I'm on a y-axis. It shows how the data are distributed across the two variables. Patterns of relationship are much easier to see. I'm on an x-axis to later. I'm on y-axis. Some have the, for example, patient magi weight ka BP ka weight ka blood pressure the relationship say if you want to study the relationship between weight and blood pressure or systolic BP either diastolic BP blood pressure study the weight in a x-axis that thamba makha sigi makha da x-axis thamba duga systolic or diastolic BP sina y-axis thamba minor plot of a relationship. How is the relationship? The if when I study to say weight yamaga BP yamra adune adu itadi sagi sigi diagram sida minor straight or diagonal the straight or much minor like ne ko adi weight in matamda BP hingale simultaneously hangat mina it will be linear gi type la ani sigi linear kind of widely scattered or facility chai chai ga later not there is no relationship there's no relationship it's scattered here and there then means there is no relationship no correlation with that the degree of correlation study between two continuous variable we use scatter diagram continuous data. The weight in BP, if it is not scattered, if it is linear, then it's very much correlated. When we increase the when it's increased, more likely to have high BP at that time. If it is scattered here and there, widely scattered, then there is no correlation at all with the relationship like they shape say the linear is minor from left from the y-axis left negative correlation another very important tool is theoretically Pareto analysis. I say Pareto chart. Pareto chart. Chart I chart. Derived from the Pareto principle, derived from Italian economist Vilfredo Pareto. Pareto principle the Italian economist Vilfredo Pareto. I say derived from he was an economist. Italian economist in the 19th century. Mana noticed throughout extensive observations and research that during the late 1890s, in Italy, 80% of the wealth and land belonged to roughly 20% of the population. Since I say economists nina mana wealth and study to sida migi 80% of the wealth say belongs to roughly 20% of the population. As 80-20 rules of high different name 80-20 rule. Now, see applicable in various day-to-day life my principles applicable or some of the examples from different industries. Health so roughly 80% of injuries and accidents happen due to 20% of the possible hazard. Ayamba injuries, accident efficiency, magi cause only exposed by only 20% of the possible hazards. Business is higher. 80% of the work is carried out by only 20% of the employees. Minor labor. Crime, the harassment. 80% of crimes are committed by 20% of criminals. Sale, harassment. 80% of sales and revenue are gathered by only 20% of the customer. What it says, the main point here is 80% of the problem and events happen because of of the causes and resources. Aduna Siddha so any care any problem identify to 80% of the problems problems cause problems gaps ayamba maram sidi cause khana only 20% of the cause khana organic when focus to focus to problem the cause solve to but we need to focus only on the 20% causes which cause the maximum problem. The graphically is effort cost 20% of the cost effort 3 are input cost 20% of the cost see say reward effect 80% say problems out of report focus not only causes the cost since resources are limited, resources can be limited can I try the focus of the report the CT is the past money analysis of the last majority of problem 80% are produced by a few key causes 20%. Step 1, first step we form an explicit table listing the causes and their frequency as part. Table for example, causes of maternal death. Maternal death cause the APS, department hemorrhage, frequencies 12. I think maternal death ki maram department hemorrhage na 12 ni shock sapana 4 ni percentage in terms of percentage shown up on the right hand side later. Postpartum hemorrhage 9 in number contributes 12.9% of the total cost. Severe anemia, maternal death, also maternal death due to severe anemia, frequency is 30, it contributes 49.97%. Jaundice 3 contributes 4.3%, others for eclampsia 5. Find out like the table number same past step. All the causes and their say will be calculated frequency so irony then percentage in terms of percentage. Step 2, we arrange the rows in the decreasing order of importance. Now in the second table we write in decreasing order of frequency we write the causes. That's from the frequency causes quite fast number 1 the severe anemia because it contributes 30 and the percentage 42.97%. Next the 12 which is because of department hemorrhage. Next is PPH 9. It's minor. In terms of decreasing order of frequency, we write we reconstruct the table. Then percentage irony. Then here we add another column of cumulative percentage. Cumulative percentage means the percentage the next row to the get the previous percentage will be added in the cumulative percentage column. Fine. same severe anemia about 42.97%. The antepartum hemorrhage study, then both severe anemia and antepartum hemorrhage, the combined frequencies is 60 like that. The postpartum hemorrhage, another 12.9%, 72.9. Eclampsia, 80% like that. The remaining see, yeah. Others, small, others the put now. The 80% of the causes are caused by severe anemia, APH, PH, including eclampsia, sin oil. When a focus on the prevent of the extraction that focus on the Sigi Marie in the first 3 or 4 causes is the focus of the if we try to reduce the number of the frequency that area, Yamna maternal death percentage decrease the just an example. Steps we add the community percentage column to the table. Other than the table plot or as a start the plot or start by faster part can severe anemia in APIs the percentage the cumulative percentage minor. Then 80% subscribe like that 80% starting from is 80% cumulative percentage last break of this is claim share about it. So this we need to focus CG areas that is focused on. That's a simple header. Another important tool for this prioritization, picture when a karamba priorities we still use a chart on a picture as when a see materialize na magi result payoff kind result big result small result or big payoff my kind of result gain gain small gain this one implementation implement of that easy part of it my later same easy to implement. Hard to implement. Implementation part, and it's in a payoff or gain, profit. Easy and part money implementation. The payoff and a big payoff, small payoff. Then we have 4 box there. Sigi box, the first box. P possible possible the one by one question Sigi box Sigi box big payoff the gain implementation is live easy to implement but it gives big payoff Sigi box na high say easy to implement, but the payoff the small or small payoff gain later. Implement the live, but payoff to delay. The third box na man high say implementation is hard so, but the result will give a big payoff. Payoff sound beginning with huge gain for the organization. The last key box in a I say implementation will be hard, but payoff the big small payoff either. Understand the PIC. PIC, city life when a farm easy to implement. with big payoff never element of the same liba to the gain si yam yam the net adu the see implement the severe gaps need no or very less resources severe gap requires need local action the implementer see the series easy to implement of the apply the payoff the related adam to we live in the possible is possible then this one series hard to implement but it will give a big payoff yes challenges in the life this is a challenge severe gap I'm gap the implement of the hard over I'm hard over but hard over also but the payoff will be very big challenge challenging only implement of the it will require since it is hard to implement more resources for the series in the last box hard to implement but small payoff jadi kanadre adi dulu bako safi am sangba but payoff small or pay gain ile adu di out of course just prioritize apuna prioritize either bypass sigi fast implement the easy to implement big payoffs in the prioritize big ni the siga ni sila challenge implement of the luba payoff na small or gadi take out of next we have run sort. Run sort helps you determine whether your process is stable, consistent, and predictable. This enables to visualize how process is performing and help to detect signals or special causes of variation. Benefits understand the process variation. Run sort, say, for example, so that monitor process performance. Example, there are 7 steps to create a run sort. Decide on the measure to be analyzed, gather the data, have a minimum of 10 data point. Minimum 10 data point like draw a graph with a vertical line, vertical line and horizontal line. On the vertical line or the vertical lines y-axis, draw the scale relative to the variable you are measuring. When in a measure variable y-axis on the horizontal line, time sequence calculate the mean, median, visible data so they get the appropriate mean and draw a horizontal line and your value going across the graph. The mean, median, and horizontal line. Plot the data in the sequence. For example, CX. It runs out for hospital acquired infections, SAI. Hospital acquired infections. On the x-axis, we have different months. 2011, January 2011, February 2011. Likewise, minor year. Time. On the y-axis, vertical axis, the number of hospital acquired infections. The whole Sigi Siboki whole average 6 later median hospital acquired infection rate 6 ni. Since we so runs after what we do is we plot we plot for this month. January there were five hospital acquired infection plot on it. February the 9,007 later will 63 hasn't got. Maybe 5 and plot out. Please the data, calculate the median events through the top one, the high C. Minor. January the median the gate, the day by Mars the hanger crack. Mars February the 6 star. Mars the hanger crack. Adamutare build up. Some hanger some are above the median, some are below the median. Now, when I must the run chart is minor plot on the now train the train are 6 or more consecutively increasing or decreasing points, indicating that special cause variation exists in the process. Train has the 6 or more consecutively increasing or decreasing. Minus some hang up a point. Point. If there are 6 or more points already train, the train is towards the increasing rate, towards the decreasing high. That means two layer and there is a cell cause variation exists in the process. Shift finally shift is 9 or more consecutive points above or below the central line. Sagi central line that points 9 or more above or below the level. So the whole can shift away. Shift going on. This is an indication that special cause variation exists in the process. Like the alternating point, 14 or more consecutive points alternating up and down indicate special tissue. Outliers, any dramatically different values indicate experience. Outliers normal value So for example, this is the measurements is from the later. This is the time. Median is 25 later. Median or average means 25 later. So already Sigi at the point 1, 2, 3, 4, 5, 6, 7. 7 points increasing trend later. Increasing angle. Other the train if we observe such things, then there's a region, there's a special region in the process, special cause variation. Sina train example is the increasing training, Sina decreasing training. So 6.1, 2, 3, 4, 5 consecutive points, 6 consecutive points shows decrease, the decreasing trend. Next, shift 9 or more points, data points above the median. Median, if we have 9 or more points, continuous one. 1, 2, 3, 4, 5, 6, 7, 8, 9 points. Above the median layer, so this is the shift layer. Below the layer, so the alternating example is decrease the way, decrease. 14, let's see, alternating. So, like it means there is a special cause variation. Special cause variation area, something is wrong in the process. Mistake proofing. Mistake proofing is the use of process or design features to prevent error or the negative impact of error. Mistake proofing. So it's for example, Lassa drugs are identified and kept separately to avoid incorrect distance. Look alike, song alike drugs identified kept separately to avoid incorrect distance. The list of look alike drugs. That's what element is sentencing to. So you list me send me the lady, send me the one. Look alike cetirizine, hydroxyzine, or tramadol, losartan, the manaba. Azithromycin, diclopara, the paracetamol, calcium, money. It look alike drugs. Same the can be the I think the somewhere like somewhere like moving manaba, diclopenic, aceclopenic, manaba, azithromycin, azathioprine. Later, anti-cancer drugs. Timian, identified separately from the bar. So, the mistake proofing money, mistakes prevent of mistake talk on the barcoding map seasonally, when you say biomedical waste, the model that you season I collect the help facilities in the barcoding system, use of project. Again, take particular page barcoding yaw the barcode of the sigis session of all gini to gini identify the company otherwise foreign mamming the president how the identify the head for the confusion the top barcoding system is final layer man the cara de lock no waste cara de lock no layer identification tag mana ang si una de ba identification tag ba so high risk drugs with maximum therapeutic dose high risk high alert drugs can high drugs with very low therapeutic index haitare ko namna magi dose effective over dose amna narrow over haitare en basi ya ba wala ga effective over ba do ga di bedoi magi kenosi karam karam na ba high alert drugs ki maximum therapeutic dose kasi therapy ma ko dunya se koi dana ba haitare Chatbot checklist, chatbot checklist. The bot, propagation of the bot correctly. Checklist में आप चीज़ ना बचे. It's an example of stack proofing, stack top में why analysis anomaly. This is so. It is one of the ways to find the root cause of a problem. Problem like that, matuli root cause. Mana hang it is simply to ask why. Problem of the why the problem occurs. When a problem presents, ask why. Why did this happen? And again, finding why and why, carrying on. But I'm some hung by that. They ultimately root cause. For example, a patient problem a patient received a wrong medication. Patient said wrong medication. Received out. Then why analysis? Why analysis? What we do is we ask why the patient received a wrong medication. The answer the nurse did not complete the patient identification process correctly. Then why the nurse did not complete the patient identification process correctly? The reason the patient did not have a wristband for identification. Patient did wristband for identification. Why the patient did not have a wristband for identification? Because the wristband was removed for a procedure and not replaced. Wristband say procedure remove the why the wristband was not replaced? The staff was unaware it needed to be put back on before after the procedure. Staff to procedure why staff did not know? My highlight there was no clear procedure or checklist for post-procedure. And the checklist procedure the protocol why when we ask why ultimately the systematic systematic cause the facility the hospital did not have a post procedure protocol appropriate about post procedure protocol the later then protocol is minor no checklist no policy protocol same as any procedures likewise we can identify any problem by asking the question again why root cause ultimately again systematic problem may come out the another chart fishbone root cause analysis fishbone cause and effect diagram so high or Ishikawa construct of the fishbone we have the central spine later the central spine we will depict the problem like from the central spine diagonal lines from the central spine bone we represent the causes and the thick causes will be grouping map maybe group say maybe machine related causes for 6M which is machine in some cases method related material measurement main mother nature 6M maybe in other situation might be patient provider policies process procedures 4S surrounding suppliers post so that's an example how to use it. First, identify the problem. Problem to identify the problem. Write it in a box and draw an arrow pointing to waiting times. And waiting time in OT whatever cost and I'm sorry. Problem to waiting time yeah. Other that is draw an arrow. Then different from the central arrow here the method environment equipment group position then say suppose methods grouping these are methods most of the problem because of both in the methodological methods is so everything. The process takes too long, lack of automation, the high too much paperwork. Method. Paperwork the files are disorganized the transport arrives early, the port scheduling, post management environment related code. Not enough treatment room, more dirt premises. Minor topic. People that are gonna expected patients staff not available, patients queue jumping, like equipment, wheelchairs unavailable, lifts are broken because of poor maintenance. Significant cause and effect. Cause ni iski bones in the cause ni iski heads effectively. Likewise, is another example of newborn death in hospital. When the high newborn death, there are any problems that manpower causes are grouped into different categories: manpower related, material related, measurement related, environment method for manpower say high newborn death by manpower, inadequate staff are not trained, less trained, staff confidence is poor, maybe the reason for material related, no proper labor room table, no dressing material, inadequate medication, causes measurement of the photograph, no photograph no Apgar scoring, then ANC no ANC then machine related, decreased illumination, warmer not working, suctioning apparatus not working, then methods, delay in treatment, poor inventory, no infection control, poor inventory environment, no hygiene maintenance. So this is just an example of this one diagram showing the different causes of high newborn death in hospital. The once we identify these different causes by drawing this one chart, rather than ito causes after brainstorming the solution that's an example. Thank you. It's a very ꯌꯥꯝ ꯁꯥꯡꯕ ꯇꯣꯄꯤꯛ ꯌꯥꯝ ꯕꯣꯔꯤꯡꯁꯨ ꯆꯨꯔꯝꯃꯅꯤ ꯈꯔꯕꯨꯗꯤ ꯊꯤꯑꯣꯔꯤꯇꯤꯀꯦꯜꯅ ꯑꯌꯥꯝꯕꯁꯨ ꯀꯩꯅꯣ ꯑꯣꯏ ꯑꯗꯨ ꯑꯦꯅꯤ ꯀ꯭ꯋꯦꯁꯟ ꯗꯣꯛꯇꯔ ꯁꯦꯁꯤꯜ ꯂꯩꯀꯣ
ꯂꯩ ꯀꯣꯏꯁꯟ ꯑꯃ ꯂꯥꯛꯑꯦ ꯀꯩꯅꯣ
ꯍꯪꯕꯤꯌꯨ ꯌꯥꯅꯤ
ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯣꯂꯤꯁꯤꯒꯤ ꯃꯇꯥꯡꯗ ꯑꯦꯛꯁꯄ꯭ꯂꯦꯟ ꯈꯔ ꯇꯧꯕꯤꯌꯣꯅ
ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯣꯂꯤꯁꯤꯁꯦ
ꯍꯧꯖꯤꯛꯀꯤꯗꯨꯒ ꯀꯩꯅꯣ ꯇꯧꯕ꯭ꯔꯥꯗꯤ ꯈꯪꯗꯦ ꯃꯥꯅ ꯀꯣꯏꯁꯟ ꯑꯃ ꯍꯪꯉꯛꯏ ꯂꯣꯏꯇꯝ
ꯀꯩ ꯍꯥꯏꯅꯣ
ꯁꯥꯟꯇꯤꯕꯂꯥ ꯆꯦꯆꯣ ꯀꯥꯡꯖꯩꯕꯨꯡ
what is the question question
about
ꯀꯩ
ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯣꯂꯤꯁꯤꯒꯤ ꯃꯇꯥꯡꯗ ꯍꯪꯉꯛꯏꯕ
ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯣꯂꯤꯁꯤꯁꯦ ꯀꯔꯤꯅꯣ ꯍꯥꯏꯕꯀꯣ ꯑꯣꯀꯦ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯣꯂꯤꯁꯤꯁꯦ ꯂꯥꯏꯛ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯌꯨꯁꯁꯦ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯤꯁꯌꯨꯁ ꯇꯧꯕ ꯌꯥꯗꯦ ꯀꯣ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛꯁꯦ ꯑꯩꯈꯣꯏ ꯄꯨꯡꯊꯥꯗ ꯊꯥꯖꯟꯕ ꯌꯥꯗꯦ ꯑꯗꯒꯤ ꯃꯥꯒꯤ ꯊꯥꯕ ꯍꯧꯔꯝꯃꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯃꯥꯒꯤ ꯁꯦꯗ꯭ꯌꯨꯜꯁꯦ ꯃꯇꯝꯒꯤ ꯃꯥꯒꯤ ꯀꯩ ꯍꯥꯏꯇꯥꯔꯦ ꯃꯇꯝ ꯁꯨꯅ ꯅꯣꯡ ꯅꯤनी ꯆꯥꯔꯝꯃꯒ ꯂꯦꯞꯊꯣꯛꯄꯁꯨ ꯌꯥꯗꯦ ꯑꯗꯒꯤ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛꯁꯤ ꯏꯐꯦꯛꯇꯤቭ ꯑꯣꯏꯔꯣꯏꯗꯕ ꯀꯩꯅꯣ ꯃꯍꯤꯛꯇꯨꯗ ꯑꯇꯣꯞꯄ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯊꯥꯖꯟꯕ ꯁꯤꯒꯨꯝꯕ ꯃꯌꯥꯝꯁꯦ ꯃꯌꯥꯝ ꯑꯃ ꯂꯩꯕꯅꯤꯅ ꯑꯗꯨꯗꯒꯤꯗꯤ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯔꯦꯖꯤꯁꯇꯦꯟꯁ ꯂꯥꯛꯄꯅꯤꯅ ꯑꯩꯈꯣꯏꯒꯤ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯣꯂꯤꯁꯤ ꯍꯥꯏꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯏꯁꯥꯒꯤ ꯌꯥꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯁ꯭ꯇꯦꯠꯀꯤ ꯑꯣꯏꯅꯁꯨ ꯂꯩꯐꯝ ꯊꯣꯛꯏ ꯑꯗꯒꯤꯗꯤ ꯗꯦꯟ ꯀꯁꯇꯃꯥꯏꯖ ꯇꯧꯔꯒ ꯃꯥꯒꯤ ꯗꯤꯁꯇ꯭ꯔꯤꯛꯀꯤ ꯑꯗꯒꯤ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯀꯩꯒꯤꯅꯣꯗ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛꯁꯦ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛꯀꯤ ꯄ꯭ꯔꯣꯐꯥꯏꯜꯁꯦ ꯑꯗꯒꯤ ꯃꯍꯤꯛꯀꯤ ꯄ꯭ꯔꯣꯐꯥꯏल ꯍꯥꯏꯇꯥꯔꯦ ꯃꯍꯤꯛꯀꯤ ꯄ꯭ꯔꯣꯐꯥꯏꯜꯁꯦ ꯂꯝꯒꯤꯁꯨ ꯈꯦꯠꯅꯩꯌꯦꯕ ꯍꯥꯏꯗꯤ ꯑꯩꯈꯣꯏ ꯃꯅꯤꯄꯨꯔꯗ ꯌꯥꯝꯅ ꯄ꯭ꯔꯦꯚꯦꯂꯦꯟ ꯑꯣꯏꯕ ꯕꯦꯛꯇꯦꯔꯤꯌꯥꯕꯨ ꯍꯥꯏꯔꯣ ꯀꯩꯅꯣꯕꯨ ꯍꯥꯏꯔꯣ ꯀꯣ ꯁꯤꯒ ꯃꯄꯥꯟꯗ ꯂꯩꯕ ꯀꯩꯅꯣꯁꯤꯒ ꯌꯥꯝ ꯈꯦꯠꯅꯩ ꯄ꯭ꯔꯣꯐꯥꯏꯜꯁꯦ ꯔꯦꯖꯤꯁꯇꯦꯟट ꯑꯣꯏꯕ ꯌꯥꯎꯔꯝꯒꯅꯤ ꯇꯧꯕ ꯌꯥꯏ ꯑꯗꯨꯅ ꯌꯥꯔꯤꯈꯩ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯣꯂꯤꯁꯤꯁꯤ ꯏꯁꯥꯒꯤ ꯁꯦꯝꯖꯕ ꯍꯥꯏꯇꯥꯔꯦ ꯑꯩꯈꯣꯏꯒ ꯆꯥꯟꯅꯅꯕ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯗꯤꯁꯇ꯭ꯔꯤꯛ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯕꯤꯁꯅꯨꯄꯨꯔ ꯍꯥꯏꯔꯦ ꯗꯤꯁꯇ꯭ꯔꯤꯛ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯕꯤꯁꯅꯨꯄꯨꯔꯁꯤ ꯑꯩꯈꯣꯏꯗꯤ ꯍꯧꯖꯤꯛꯇꯤ ꯑꯦꯗꯚꯥꯟꯁ ꯂꯥꯛꯄꯗꯩꯗꯤ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤक ꯄꯣꯂꯤꯁꯤ ꯂꯩꯕ꯭ꯔꯥ ꯑꯗ ꯂꯣꯏ ꯍꯪꯉꯦ ꯌꯨ ꯍꯦꯞ ꯌꯣꯔ ꯑꯣꯟ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤक ꯄꯣꯂꯤꯁꯤ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤक ꯄꯣꯂꯤꯁꯤꯁꯦ ꯀꯝꯇ ꯅꯠꯇꯦ ꯑꯩꯈꯣꯏꯅ ꯁꯤꯒꯤ ꯂꯥꯏꯅꯥꯁꯤ ꯂꯥꯛꯄ ꯃꯇꯝꯁꯤꯗ ꯀꯔꯝꯕ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯁꯤꯖꯤꯟꯅꯅꯤ ꯍꯥꯏꯕꯗꯨꯅꯤꯅ ꯁꯝꯅ ꯍꯥꯏꯔꯕꯗ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯤꯖꯤꯟꯅꯕꯒꯤ ꯆꯣꯏꯁꯦꯁ ꯋꯤ ꯍꯦꯞ ꯁꯣ ꯃꯦꯅꯤ ꯆꯣꯏꯁꯦꯁ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯂꯣꯠ ꯑꯣꯐ ꯆꯣꯏꯁꯦꯁꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯁꯤꯖꯤꯟꯅ ꯌꯥꯕꯁꯦ ꯑꯦꯅꯤ ꯍꯦꯛꯇ ꯁꯤꯖꯤꯟꯅꯕ ꯌꯥꯗꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯍꯣꯁꯄꯤꯇꯥꯜꯁꯤꯗꯗꯤ ꯑꯩꯈꯣꯏꯒꯤ ꯖꯒꯥꯁꯤꯗꯗꯤ ꯑꯁꯤꯒꯤ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛꯁꯤ ꯏꯐꯦꯛꯇꯤቭ ꯑꯣꯏꯅꯤ ꯑꯣꯏꯔꯣꯏ ꯍꯥꯏꯕꯁꯦ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛꯀꯤ ꯔꯦꯖꯤꯁꯇꯦꯟꯁ ꯄ꯭ꯔꯣꯐꯥꯏꯜꯒꯁꯦ ꯈꯪꯉꯀꯥꯟꯗ ꯑꯩꯈꯣꯏꯅ ꯁꯤꯖꯤꯟꯅꯁꯦꯅ ꯍꯥꯏꯕꯒꯤ ꯀꯩꯅꯣꯗꯨꯅꯤꯀꯣ ꯑꯗꯨꯅ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯣꯂꯤꯁꯤꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯑꯗꯨꯝ ꯂꯝꯁꯦ ꯈꯦꯠꯅꯅ ꯑꯗꯨꯝ ꯂꯩꯕ ꯌꯥꯏ ꯑꯗꯨꯒ ꯑꯩꯈꯣꯏꯒꯤ ꯏꯁꯥꯒꯤ ꯁꯤꯒꯤ ꯂꯥꯏꯅꯥꯁꯤ ꯂꯥꯛꯑꯒꯗꯤ ꯁꯤꯒꯤ ꯏꯟꯐꯦꯛꯁꯟꯁꯤ ꯂꯥꯛꯑꯒꯗꯤ ꯑꯩꯈꯣꯏꯒꯤꯗꯤ ꯐꯥꯔꯁ ꯂꯥꯏꯟ ꯑꯣꯐ ꯁꯤꯁꯤ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯤꯅꯤ ꯍꯥꯏꯕꯗꯨꯒꯤ ꯑꯗꯨꯒꯨꯝꯕꯒꯤ ꯒꯥꯏꯗꯂꯥꯏꯟꯁ ꯀꯩꯅꯣ ꯃꯌꯥꯝꯗꯨꯅꯤ ꯑꯗꯨꯃ ꯂꯩꯔꯦ ꯑꯗꯨꯒ ꯂꯝꯁꯤꯒꯤ ꯈꯦꯠꯅꯕ ꯌꯥꯏ ꯑꯗꯨꯕꯨ ꯋꯤꯗꯤꯟ ꯗ ꯁꯦꯝ ꯗꯤꯁꯇ꯭ꯔꯤꯛ ꯌꯥꯝ ꯆꯥꯎꯕ ꯅꯠꯇ꯭ꯔꯒꯗꯤ ꯑꯩꯈꯣꯏ PHCꯗꯁꯨ ꯑꯩꯈꯣꯏꯅ ꯑꯦꯟꯇꯤꯕꯥꯏꯑꯣꯇꯤꯛ ꯄꯣꯂꯤꯁꯤ ꯁꯦꯝꯕ꯭ꯔꯥ ꯃꯥ ꯃꯁꯥꯅ ꯁꯦꯝꯖꯔꯒꯗꯤ ꯐꯔꯦ ꯕꯠ ꯑꯣꯜꯋꯦꯖ ꯏꯠꯁ ꯕꯦꯇꯔ ꯇꯨ ꯂꯨꯛ ꯑꯦꯠ ꯑꯩꯈꯣꯏꯒꯤ ꯗꯤꯁꯇ꯭ꯔꯤꯛꯀꯤ ꯍꯥꯏꯇꯥꯔꯦ ꯗꯤꯁꯇ꯭ꯔꯤꯛꯀꯤ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯃꯥꯒꯤ ꯍꯥꯌꯔ ꯁꯦꯟꯇꯔꯒꯤ ꯂꯩꯔꯒꯗꯤ ꯃꯗꯨ ꯑꯗꯨꯝ ꯑꯦꯗꯣꯞ ꯇꯧꯊꯣꯛꯄꯁꯨ ꯌꯥꯏ ꯃꯗꯨꯃ ꯂꯩꯔꯦ ꯑꯦꯅꯤ ꯁꯤꯗ ꯀꯩ ꯍꯪꯅꯤꯡꯕ ꯂꯩꯔꯤ ꯍꯜꯂꯣ ꯇꯥꯔꯤꯕ꯭ꯔꯥ
ꯇꯥꯏꯌꯦ
ꯌꯥꯔꯦ ꯑꯦꯅꯤ ꯌꯥꯔꯕ꯭ꯔꯣ ꯁꯦꯇꯤꯁꯐꯥꯏ ꯑꯣꯏꯔꯕ꯭ꯔꯥ ꯀꯔꯤ
ꯃꯌꯥꯝ ꯑꯩꯅ ꯐꯤꯗꯕꯦꯛ ꯐꯣꯝ ꯑꯃ ꯆꯦꯠ ꯕꯣꯛꯁꯇ ꯑꯃ ꯍꯥꯞꯄꯅꯦ ꯑꯝꯇ ꯑꯗꯨ ꯈꯤꯇꯪ ꯐꯤꯜꯑꯞ ꯇꯧꯕꯤꯔꯛꯎ ꯏꯟ ꯗ ꯃꯤꯟ ꯇꯥꯏꯝ ꯀꯣꯏꯁꯟ ꯂꯩꯔꯒꯗꯤ ꯑꯝꯇ ꯍꯪꯕꯤꯔꯛꯑꯣ ꯑꯇꯣꯞꯄ ꯑꯦꯅꯤ ꯋꯥꯟ ꯐ꯭ꯔꯣꯝ ꯗ ꯄꯥꯔꯇꯤꯁꯤꯄꯦꯟꯁ ꯑꯦꯅꯤ ꯋꯥꯟ ꯐ꯭ꯔꯣꯝ ꯗ CHO PHCꯒꯤ ꯀ꯭ꯋꯥꯂꯤꯇꯤ ꯇꯤꯝ any question Sigi quality management ki part se yamna kenosu oibanina yamna su chawi yamna su kitang khangmada khara kenosu oi adagi practically keno tawdragadi amuk apply tawdragadi keno tawbagi keno mayam asu lei anyway Dr. Denina mayam ama koigi karina karino adugumbagi mayam ama haibire do particular area da specific oina example ke yaurga su keno tawragadi hena secho gumbadadi kitang keno oigadaba male interesting oigadaba haitare ko day to day moigi keno tawbada day to day phakjat tawbada changba keno kai haitare ko we will come back with that in the meantime sigi keno koi chat box ta aina form ama thajabane adu kitang fill up tawbiro and if anyone is question hanging bala ragadi ta hangbiro langol tarungdagi audit committee gi maramda ama hange Dr. Deni amta khumbiyo
question se kai no question se kai no
who should comprise the audit committee na ama hange chat ta yagun audit committee gi magi kaino committee du kana kana yagodamno haibdo adugi kaino
audit committee se different levels of hospital haitare ko hospital da di akogi experts sing adita sida dam akogi medical superintendent chair toroga dam to yare adagi then audit ga di akogi medical audit haitare medical audit ki audit se makno kali am lekra adagi committee gi kaino medical superintendent na oirani hospital gi kaino adagi MO PhD level di MO in charge na dam oibe yai adagi different nursing superintendent yaurani adagi di akogi staff akogi even kaino adagi pharmacy gi kangbu lab gi kangbu in charge lairiba akogi different department sigi lairiba kaino singse adum yauba yai samna habda adu audit di kaino oire mai gi makam makal gi maternal death ki di audit ki lei gani gi expert sing yawan bakot ba mayam dai de do hujik se koigi kaino gi oina di health and wellness center kumbagi kaino da di si committee ga semna to gi di kaino leite ko semda ba yadi ha gi leite inga sa haije gi di just hospital secondary level hospital haiter sub district hospital ki level di district hospital level di takala ideni to even for PAC level kano di takala from the district ki kano dum yaane aduga adumaina kano hospital ki hargadi ina representative treatment care experts from different haitare line haitare pediatrician yaubi hai gynecologist yaubi hai surgeon mayam se audit committee da loine yaubani nursing staff ta gi yaubani laboratory room ki pharmacy ki mayam se yaubi atubu PAC da di element center da di sembagi takar lele yarani ko
okay any other questions from the participants question namal orga let's wind up anyone from CHO arm SC
Thank you, Tamo Deni. Yam phajana explain to bigre quality management ki part se mayam na tabada su hana kai gumba hana ama aung ta tawdriba oita gadi kita confusion lamba yai ko otherwise tauba hauramgadi ngasigi session sidagi tasengna phajana kanaba phangamgane khalle aduga makata na ina haijegadaudi quality management ki tools mayam se akoina something pabaga theory taubaga tauraga ani se khenaba yam laiko horen taura akanda ngasi tamodeni na explain taubikhriba mayam se hena su ningjanga kaneba once you start doing adu daiduda akoina kenogi process mapping ama taubabu oiro PDCA yekpabu oiro any audit taubabu oiro taurakanda hena ngasigi session gi kana se hen urakkanboko aduna our sincere request quality gi tools mayam je kitang pabiraga kitang tauba hautaragadi ngasigi session sigi asengba magi keno se lakani eta horen keno questions je laitri se if we start doing quality tools adurgadi questions je yam thuklakaneba aduna at least khara khara sum haidi enwas ki side by side tau na koi ki lairiba problem mayam se adugi quality tools khajik khajik sum sizinaba hobiyo bako just like hozik show tawbiri se sumaina aduna akoigi PDCA ha kanda at some after some point of time akoina huzik se PDCA amamam khaka semaga akoina wall daga thelaga thamise sumaina tawgadaw natte bako akoigi gap mayam lai in akoigi quarterly yengakpa matam gap mayam laini adu gap mayam dugi PDCA se mayam yam thoklakaneba aduna register ama semaga plan gap na kaino plan na kaino do na kaino check na kaino act na kaino sigi prioritization sina karamba category de challe ha base koi register ma da mayam ama thoklakaneba ko so please koi khaji khaji tha amamam gi amamam bu oiro kitang just step amamam plan khatang bu tawbu oiraga su lairiba gap mayam se if yam sengna hairabada quality da di gap se lairing khai phaiba because akoina gap to laitaraga kaino ma na tawgi opportunity ma phangeba gap laite gap am laite haragadi akoigi process mapping se pura perfect oire haragadi semdok ningai laitragadi aduduni hena problem oeba so requesting all facilities to start implementing quality tools in small akoigi ising ta dababu oiro waiting time keno tawdababu oiro staff ki behavior dabu oiro small things adugumba da khaji khaji gadagi process mapping small akoigi patient na hidak law akoigi register tawba lakpadagi na ngasai ki hidak lawraga chatkibo ki process angang pagi process sugumba mayam je small things se head ngasai tamodeni na haibiriba process mapping dugi structure mayam do sizina biraga start adagi sida changba lab ta changba lab ta investigation lawraga ngai daba diamond shape ta sizina ga yes no tawba adugumba mayam je sana na kitang start tawba haubiyo then hek tawba hauba matamda thoklakadoriba confusion mayam do adum district or state level da put up tawbiro ba then aduga makata na muk tawminase so thank you so much tamodeni ngasi yam phajana session
Thank you thank you everyone
Thank you so much.
for your patient hearing haitareko next mathangdasu ai atopa topic kharadasu ngangba ngamba oijage thank you
Thank you Tam.
Ma'am, let's wind up. Thank you all.
Thank you.